Kentucky. This is Listens Live.
Hello, everyone. Good afternoon, and thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky. It is Tuesday today, and of course, we have got a fantastic show dialed up for you today. Let's take you to the rundown now and show you who you can expect. We've got Cornerstone Wellness Center here talking about all things neuropathy, how you can get some relief. We have Goodwill Industries of Kentucky back with us here on Listens, talking all about the Excel Center. We're going to hear from a student coming up. Also, we have Freedom Mini Dental Implants back with us here on Listens. They're going to help you get the smile that you deserve. So as we bring you here into the studio, you know Dr. Regan Ackerman from Freedom Mini Dental Implants. Been a while since you've been here, though, so it's good to see you.
Thanks.
If we are doing just a quick overview of everything that you specialize in for anybody that hasn't seen you in a while.
Yeah, certainly. So I specialize in what we call the mini dental implant. The mini part just means that it's a smaller diameter implant. So it's a lot less invasive, less healing time, and usually less costly than kind of the bigger surgical, more traditional implants. And a lot of what I'm able to do is help people that were told maybe they're not a candidate for the surgical implants because they didn't have enough bone, or they had to do like a graft or a sinus lift. A lot of times I'm able to place the mini dental implant where they weren't a candidate before. We use the mini dental implants for what we call denture stabilizations. Help tons of people that are struggling with dentures. They can't wear them, they move, they flop, get rid of the denture glue. We're able to use the mini implant to make a snap-in denture. I can replace a single tooth with a mini implant, or we can do permanent teeth and like throw the denture away with the mini implants.
I think one of the great things that patients like about you too is they get to see you on the show here, and when they come to the office, you are the person that is treating them.
Yeah, I'm glad you brought that up. We are not corporate, family owned. My husband works with me. We're a small office, so I'm the only dentist there. So you will see me. I basically do, almost all your treatments start to finish. So you're not going to be just a number to us, or thrown into that corporate dental world. So we're small. We are in the Fern Creek area on Bardstown Road. We do free consultations. So I know we'll go in more detail and show models and everything. But if this is something you think you need, or a loved one needs, or a friend, just have them call the office. It's a free consultation. It includes a 3D x-ray, to confirm you're a candidate and you do have enough bone. And then I will, meet with you, sit down with you. We'll go over process, cost, expectations. But like you said, it is just me there. I'm the only dentist.
We like it that way. As we talk about, you mentioned the models here. I think this one that's closest to me does a good job of showing what mini actually means.
Yes, I think it speaks, volumes for kind of explaining the difference. So when I place a mini implant, I do not have to make this big hole. That's kind of the more traditional one where they make an incision, place an implant. It can almost be like a year-long process back and forth sometimes. So the mini implant, I'm gonna cover this hole up because it's hard to see. So there's a little small hole right here, and that is the hole, kind of what we call a pilot hole, that I have to make to place the mini implant. So as you can see, I don't have to have as much bone to place an implant. So a lot of people that were, like I said, told they didn't have enough bone, to place the big implant, a lot of times I can place a mini implant. I hear this a lot with people that have had lower dentures for a long time, and their lower denture is just moving and flopping. They were told they had no options. And a lot of times they come see me and they still have enough bone for us to do a mini implant and then be able to snap their denture onto this. But like I said, no incisions, no stitches, very minimally invasive.
These other models that you brought do a good job of showing who might be a candidate based off what their needs are.
Yeah, certainly. So this is kind of one of the most common things that I've kind of been referring to is the snap-in denture. So place the implants, local anesthetic, don't have to put you to sleep, no sedation. Like I said, no incisions or stitches. The day I put these implants in, so the same day I put the implants in, I will put these attachments inside the denture, and you will leave that same day with your denture snapped on to the implants. Okay, so then no more denture glue. If you're a gagger, a lot of times we can trim some of that off the roof of the mouth to help with that gaggy feel. And then you'll wear the dentures 24/7, but you'll snap them out once a day, rinse and clean them, snap them back in. Don't have to deal with gobs of denture glue anymore. You can eat better, eat that steak again, all that food that you've been missing.
It's one of those things that you've had patients tell you it's been life-changing for them.
100%.
I know we have some before and afters. Want to make sure that we have time to get these in, because it's always great to see and hear from the people.
Because these are real people with real stories.
Live in our community.
And lots of people are struggling with similar situations. So this is Lonnie. His teeth had just deteriorated over time. He had worn them down, and so we were able to do a snap-in denture on the bottom and kind of a semi-permanent teeth for him on the top. But life-changing as far as changing his smile, his function, because his other teeth were so worn down that he wasn't really, chewing food properly. So, able to do that for him, definitely life-changing. And then this is Tanya. She knew she needed all her teeth taken out. They were decaying, fracturing. So we were able to do snap-in dentures for her, because she knew she didn't want regular dentures either. She had heard all the stories of glue and flopping around, and some people can't even wear them. So we did snap-in dentures for her. Life-changing, her smile, her confidence, 100%. And also, she knows she has dentures that are stabilized. They're not gonna, you don't have to worry about if you're talking or you're eating and they're flopping out. So, and then I think the last one, Kim. So many people are like her, and a lot of people don't realize it, but she had to have all her teeth taken out, thought she was going to wear dentures, thought everything was going to be great. She could never wear her dentures. So she was not wearing anything for at least a year. She was an extreme gagger. And we'll show the model, but I was able to do the permanent teeth on her. So there's nothing on the roof of her mouth on the top, so she can have teeth and not gag. And she's got the permanent teeth on the top and a snap-in denture on the bottom.
We've got less than a minute left, so let's hit that model, show exactly what you were talking about, and then best way to get in touch with you, of course.
So this is the permanent teeth where it trims back. It's just teeth, so no denture. And then it gets cemented on permanently, so it's like getting your teeth back. You have nothing on the roof of your mouth anymore. So for Kim, that was humongous for her, because she was a big gagger. So we got the permanent teeth, so she could have teeth now and not gag. And like I said, we're on Bardstown Road in the Fern Creek area. Just give us a call, 502-937-4930. It's a free consultation. We'll see what your situation is and go over, process and cost.
Speaking of situations, last thing that we should add real fast, we didn't have time to get to one of the models, but not everybody needs all of their teeth.
Exactly.
You can help.
I can do just one tooth.
Okay. Yes. We will leave it at that. Good to see you, Dr. Ackerman, as always. Stay with us here on Wave Listens Live. 2 more great segments to go. Up next, we'll talk with Dr. Doug Kane from Cornerstone Wellness Center about how you can get relief from neuropathy.